This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydroease Tablet is a vital medication for women experiencing progesterone deficiency. It helps alleviate various symptoms, enhancing overall reproductive health. Indications and uses. This medication is utilized to relieve menstrual pain, manage symptoms of endometriosis, and alleviate premenstrual syndrome. It also aids in correcting infertility issues and irregular periods, providing essential support for women's reproductive health, especially during postmenopausal transitions. How it works. It works by improving the thickness of the uterine lining and replacing deficient progesterone levels, thus alleviating various hormonal deficiency symptoms. Directions for use. Take the medication as advised by your physician. It should be swallowed whole with a glass of water. Do not crush or chew the tablet. Consistency is key, so try to take it at the same time each day. It can be taken with or without food, and the correct dosage will depend on your age, body weight, and medical condition as determined by your doctor. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and painful or heavy menstrual periods. If any side effects worsen, it's crucial to consult a healthcare provider. Precautions and warnings. Exercise caution if you have liver or kidney problems, a history of depression, or any allergies. Pregnant or breastfeeding women should only use this medication if deemed necessary by a healthcare professional. Regular monitoring and consultations with your doctor are essential to manage potential risks. FAQs. 1. What is Dydroease Tablet used for? It is used to manage progesterone deficiency states and alleviate related symptoms. 2. How should it be taken? It should be taken as advised by a physician with water and not crushed. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it suddenly? No, do not stop without consulting your doctor. 5. Is it safe for children? It should be used in postpubertal females only if prescribed. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below.